off. How you doing today, sir?
I'm doing well. How are you, young man?
I'm doing well. My name's Kenneth.
Nice to meet you, Kenneth. I'm Earl.
Nice to meet you, Earl. So we're gonna come in. I've talked with your doctor. We're gonna kind of discuss some of the issues that are been going on with you.
Okay.
I've kind of got a little bit of background information from the doctor as far as your health goes. I kind of work with the doctor and the rest of the health team here at the Springfield Clinic. I'm a behavioral health consultant as well as a LCSW. This right here, this is a brochure of the services that we provide here at the clinic. So a little bit later, after our session here on today, if you want to take a look and kind of see what all we do, that'll be good. I work as a part of the primary care team. So basically what I do is I work with the doctors, I work with the nurses, and with the mental health specialists here, to kind of look at the whole person. We look at not only your physical health, but we look at your mental health, your emotional health. Really just trying to figure out, the whole person, because a lot of times people have, physical issues, but sometimes there's other things, environmental issues or emotional issues that tie in with that. That, truth be told, doctors don't always necessarily pay attention to those things. So we'll kind of be talking about some of those issues. I'll go back and I'll talk with the doctor after this. We'll kind of discuss what we talk about here. Everything that we discuss here, obviously, we'll go back to the doctor and he'll kind of evaluate. So today we'll be talking for about 20 minutes.
Okay.
So it'll be not a very long session. I will be asking you a lot of questions. Basically what I'm trying to do is just kind of get to know you, get to know your current living situation and the problems and stuff that you may be experiencing at this time. In order for me to really help you, I got to get to know you. So that means I'm going to have to ask you a lot of questions. So it's all meant to be for helpful in the long run. So we'll spend about 15 minutes or so talking, or I'll spend about 15 minutes asking you questions. And then after that, for about the last 5 minutes or so, we'll try to see if we can't develop some sort of plan to maybe address what you may consider the main reason that you're here today. I will be taking some notes as we go. So if you see me kind of just jotting stuff down, then it's just stuff that I can take back to the doctor.
Okay.
So I'll chart, as we go. Everything will be a part of your medical record. And then I'm also have the same reporting responsibilities as other team members, as far as reporting, confidentiality, and danger and safety issues. So everything that you may have discussed previously in regard to confidentiality and informed consent, all that, then same applies to me. So we'll kind of get started. But before we get started, do you have any just general questions?
Nope, this is the first time I've seen one of you type of people, so that'll be okay.
Okay, all right. So I take it, I guess the first question I kind of have is what kind of brought you here?
I really need to quit smoking. I've been smoking ever since I was a youngster. It was just kind of what you did. Mm-hmm. And it kind of been interfering with my life recently. I haven't been able to do a lot of what I want to do, and I've tried to quit once or twice before in the past, but it just never really took.
Okay.
So figure I better do something for my health now at this point.
Okay. Are you experiencing any other issues related to the health? Do you feel like there's problems in particular that you can pinpoint?
My doctor says I've got high blood pressure.
Okay.
And that it doesn't make me feel very good. It's kind of hard to describe. I just feel kind of worn down, and my chest hurts a little bit, and I hear that gives people heart attacks, and definitely don't want one of those. But for the most part, it's just I just can't do the things I wanted to do, and so that just kind of bugs me.
Okay. And when did that all start? I know you said you've been smoking for a long time, but
Yeah.
when do you feel like you kind of really started to have these problems associated with?
It's been a couple months. I mean,
Okay.
about 4 months ago is when I got diagnosed with the high blood pressure, and the doctor put me on some pills.
Okay.
And the pills were okay. I mean, we've changed them up a couple times, and he says my numbers look better, but I don't feel any better, so I don't know what good the numbers did me.
Okay. And you're taking those medications on a consistent basis?
Yeah, I know my wife makes sure that I get them with my meals.
Yeah, sometimes that's good to have the wife there to kind of keep us in check at points in time. So, so you don't really feel like anything has gotten. I mean, as far as how you're feeling, you're not really feeling any different at all.
Well, I mean, I'm feeling it's kind of that. It's just things are getting worse. Like I don't feel like the medicine's helpful. I mean, I trust my doc. He's one of those young, smart guys, so I think he knows what he's talking about. But I just can't do what I used to do last year, and so that just kind of bugs me. And I want to, I'm still young. I mean, I'm only 50. I want to, be able to kind of do what I can do until as long as God gives me.
Yeah. And what kind of things are you, what type of things is it kind of impacting? What can you not do that you had relative ease doing before?
I used to babysit my grandkids quite a bit. I mean, my kids are just great. They've got to give me 3 great grandkids, and I just absolutely love them to death. I love to, spend time with them when they're at work. Take them to the park, take them to Silver City, do all that kinds of stuff. And I've had to cancel a lot just because there are days I just really just don't feel good. Days that I just don't really feel like I can muster up kind of the energy to leave the house. That, and I mean, I like going hiking on the weekends, go down to, the nature center in the Busick and, walk around. But I just, it's not something, I can't go all day like I used to. I got to stop. And that just makes me feel like an old man.
Yeah, it sounds like it's kind of robbing you of a lot of things that you really like to do, So having the grandkids around and all that, and not being able to do those things, I can imagine the difficulty with that. So, is it interfering with your job at all?
Well, I mean, I'm retired.
Okay.
I mean, I worked really hard now, so I don't have to anymore.
Okay. And what about sleep or eating habits or anything such as that?
Not really. I mean, I enjoy a good cigarette after a meal, like any red-blooded American does. But sleep-wise, I sleep just fine. I mean, I'm more tired than I used to be, but I'm sleeping okay.
Okay, all right. And then what about maybe social interactions? Do you go out much? I mean, I know you talked about the recreational stuff, but do you do?
Well, I mean, we can go down to the VFW and hang out and play bingo and all the stuff I used to do. Smoke when I smoke, and a lot of places you can't smoke at anymore. So I smoke mostly at the house and in the car, but it's not stopping me from doing my normal stuff. Just aside from just the grandkids and the walks, I mean that doesn't really. It's just anytime I'm really active. Like if I'm watching my shows or going to church or stuff like that, that's fine. But I'm not up dancing and shaking or chasing people.
Yeah. Okay, so it's just low energy, it sounds like. Do you feel like your relationship, like with your wife or maybe others closer to you, has been affected anyway as a result of any of this?
Well, like I said, I know I'm disappointed in my grandkids, and that kind of hurts my heart a little bit. It makes it harder on my kids too when I got to kind of cancel last minute. But in terms of my wife, I mean, she loves me and supports me, and obviously she'd like me to stick around for as long as possible. But I mean, it's like I'm not any angrier or
So your mood is pretty much the same.
Yeah.
No difference in mood. Okay. Well, I guess the next question that I have is, what, I guess to back it up a little bit, what is I know you said your wife is a little bit concerned about, the smoking. So are you smoking currently? You're still
2 packs a day.
Still 2 packs a day. So,
yeah.
So you're not, and have you cut back at all? Or were you at 2 packs prior to going
I've been
to the
at 2
doctor?
packs pretty steady for about the last 20 years.
Okay. And what's been is it I mean, it sounds like you want to get better.
Yeah.
Obviously, you want to, you've voiced some of the things that you want to be able to do again. And you say that the medication isn't necessarily really helping. Do you feel like maybe cutting back a little bit on your smoking?
Well, I tried to quit cold turkey and just put them down enough, throwing away packs of cigarettes and shattered my ashtrays and threw my lighters out in the back of the field and the whole 9 yards. But a couple of days goes by and I just feel like absolute garbage, and I just feel normal smoking. And I mean, the doc says it's not good for me, and I'm feeling like it's kind of wearing me down a little bit, but just saying, all right, now stop.
And especially for someone who's been smoking, for a long time, I don't know if doing cold turkey is even the best idea. I mean, I'm not the doctor, obviously, but I think if for someone that has been smoking for a very long time, I think maybe a gradual decrease, or maybe even what type of medications are you actually taking? I guess.
I don't know. It's like lisinopril, something like that. I don't know these fancy words.
So and these are just smoking cessation.
Well, that's just for my heart.
Oh, that's for your heart. So you're not doing any type of smoking cessation stuff. So that could be a possibility as well, as to try to incorporate some Chantix or something like that to kind of help reduce the cravings, and then over time, then what you could do is just cut back on how go from 2 packs a day to maybe a pack and a half, or 1 pack, and ultimately just get it, work it down a little bit to where you're not just cutting it off, and smashing ashtrays and.
Well, I mean, I come from the generation where if you're going to do something, you do it. Yeah. And that's just really hard with this.
Yeah, and I understand that. So I think that there is a way. I mean, I think that your desire, I mean, it sounds like your desire, to do some of these things that you're wanting to do, activities that you haven't been able to do in the past. I think we can build on that, and we kind of use that as motivation, and kind of see how you feel. I mean, if we do, say we implement something, or we try to do maybe some Chantix, or we try to do cut back a little bit. I know you say, oh, it's all or nothing, but I think sometimes we have to do a little bit a different strategy, to try to see. And if you're willing to do that, I think that there's some things that we can do to kind of try to transition into that area to where you're no longer smoking at all. And then I think over the course of that time as well, what we'll be able to see is how you're feeling. You'll be able to gauge, okay, I was at 2 packs a day before I started decreasing, and then kind of gauge, we could either keep a journal or something like that, and you could say I felt a little bit better. I went on a walk today, and I was able to walk a little bit further than what so as I think you see, I think trying to go from I'm doing it all and then I give it up. I mean, you're gonna there's a lot of physical things that you're gonna be dealing with, it's gonna make it hard, but I think that gradual just kind of stepping down, engaging where you're at emotionally, and just physically, I think that'll be beneficial for you ultimately in the long run. So I guess we can kind of, since we've kind of discussed some of these things, do you have anything else you want to kind of referring to the smoking that we haven't really hit on yet?
Well, I mean, not really. I mean, I'm not used to these head doctor type stuff.
Yeah. Well, we're just here to help. Try to get it. And try to. I guess one other question that I do have for you: do you have any other environmental stimuluses that kind of cause you to want to smoke at times other than other times? Do you get around friends at certain times? Everyone's smoking, so it's easier for you to smoke then, or
I've got a couple friends that quit smoking. I mean, they still kind of spend time with us, and but I'm used to getting up and having a cigarette first thing, have a cigarette and coffee to wake up, cigarette after meals. And, if I'm just out tinkering in the shop, kind of smoke while I'm doing that. And, I used to be an over-the-road trucker, so I'd, smoke while driving and stuff like that. So, I mean, they've just been, you don't do much in life if you're smoking 2 packs a day that doesn't involve a cigarette at some point in time.
Yeah. That's a very true statement. So, well, I think what we can do is we can maybe try to just kind of formulate a plan, and then whenever we see each other next time, we can maybe evaluate, maybe some steps. So, what do you think about? I mean, because this is your life, and I want this to be something that you want, and I don't want to set goals for you. I want to do it together. And we talked about the gradual decrease. Is that something that you think we could possibly try?
Oh, it's worth a shot. I mean, it can't go any worse than trying to quit cold turkey and not doing it.
Okay. So, and what I'll do is I'll talk, and I know that Chantix has been a medication that others have used, and I know that it's been effective with some people. So, what I would like to do is talk with the doctor, try to get you a prescription for some lozenges or some patches or something like that. And then what I would like to do is over the course of the next couple weeks, before we see each other, if you would do kind of like I said, and we can agree. Okay, say if you're smoking 2 packs a day, so you're smoking 40 cigarettes a day. So, I mean, what do you think would be a reasonable goal to cut back from say over the next? Let's just do it in like week increments.
Okay.
Say the first week, maybe. What do you think you could do as far as cutting back?
Well, I mean, just kind of cutting back a little bit at a time seems pretty reasonable. I can maybe try to do like 2 or 3 cigarettes a week and kind of cut those down.
So cut down from 40 cigarettes to 37, or is that what you're saying?
Yeah.
Okay. So I think to start off with, that's very reasonable, and then we can try that for the first week, and then what do you think about maybe that second week? Maybe cut back another 3,
2 or 3 down. Yeah.
Okay. So that's what we'll try to do. Let's set that as a goal. This first week, I would like for you to just jot down, what you smoked each day. Just be honest. I'm not here to judge you. I'm just here to kind of work with you. And if you smoke more, then you smoke more. If you smoke less, then you smoke less. It's not really about me trying to be over your shoulder looking at you. It's just about me trying to work with you and us get to that goal. So whatever you smoke, just jot it down. And then we'll reconvene, in 2 weeks. We'll see where you've been. And also what I would like you to do is just, try to do some of the things that you do. Is there anything that you do, 2 or 3 times a week? Do you?
Well, I mean, the wife and I like to go out to eat every now and then. So we go out to eat a couple times a week with some other couples. And,
okay. Is there anything you do that kind of you feel like it caused you maybe to exert energy? Maybe you're feeling a little bit tired, like you weren't before, but now you are. Something that we can kind of gauge, like Well,
definitely like my walks on the weekend. I always try to do those, and I still go even though I can't go as far as I used to.
Okay, all right. So let's use that. Let's incorporate that, and what I would like you to do is just jot down when you went, how long you were able to walk for, and also when you started to really start to feel that. Because overall what we want to do is in the long run, cut down the cigarettes and extend the walk time, and just kind of go from there.
Okay.
And then so I think that would be a major thing that we could do. And then we'll see, reconvene, with the doctor and kind of see. I know that you have the issue with the high blood pressure, so we want to kind of go back and see if what we're doing in regard to the smoking, maybe that'll help, get that blood pressure down a little bit, and hopefully, keep you around a little bit.
Well, I definitely would like that. Well, thank you so much, young man. I appreciate it.
Okay. Well, I appreciate you coming in today, and we'll see you again in 2 weeks.
All right.
All right.
Thank you.